Hello friends, did you know that in Rwanda, over 20% of the population is aged between 15 and 25 years old? Yet many face barriers in accessing quality information and sexual reproductive health services. I'm co-founder and operational manager at Mushuti Wanjye Limited. Mushuti Wanjye Limited is a company that is addressing issues existing in sexual and reproductive health sector. Our mission is to improve the access of quality information and sexual reproductive health services, specifically to adolescents and youths. So as you can see, this is our prototype for our solution we are bringing. This is the kiosk. As you can see, here is the part of the audio content as I told you earlier. And this is the part for the dispenser, condom dispenser, contraceptive dispenser. You may wonder to ask how it works. So I'm going to power it on right here. You see now it is powered on. So the coin sensor, what we have to do is to insert the coin right here, and then the condom will automatically come. This is where the intelligence comes. So I'm going to insert this coin right here, and then the condom will come. Alright, I get my condom. But there is also an option so that you can, there is a free option where you can get the condoms without payment, but it really depends on the deployment because we are still refining our business model.
Good evening, a very wonderful Sunday evening here at the Unipod within the University of Rwanda, campus of science and technology. Again, we welcome you back to the niche YouTube talk show focusing on innovation and excellent or exemplary entrepreneurship and business strategies. So today we are joined by Jean-Claude Iradukunda. He has a prototype of a self-vending machine, and this is trying to address sexual reproduction using technologies like IoT. So Jean-Claude, welcome to the niche, and please introduce yourself and the solution.
Thank you. I'm by the name of Jean-Claude Iradukunda, as you said. I'm a graduate from University of Rwanda, College of Science and Technology from Kiosk. And personally, I'm passionate about embedded systems and IoT.
Yes, I'm also from the University of Rwanda,
Okay.
when it was called Kiosk. Please talk more about this solution. As you know, I could not explain it in detail, and I'm sure the followers are already wanting to hear more about it.
Yeah. Thank you. Our prototype, we called it Mushuti Wanjye Kiosk. Actually, it's a device which is intelligent, and it aims to provide the sexual and reproductive health services, the secretary. And the reason that driving us to develop such kind of solution was the challenge existing in sexual and reproductive health sector. Like from the research that we've conducted, we found out that many young people, especially adolescents and youth, face the problem of accessing the quality information and the services regarding sexual and reproductive health. And that leads to doing unintended actions like doing unprotected sex, leading them to drop out from the school, for instance, or other effects. So then from that research, we found that the really root cause problem of that problem is that there is fear of judgment due to cultural norms. Like if I'm going to access the condom in the shop and I find like 3 to 5 people there buying other products, I may have a kind of fear of judgment, fearing that they are going to know what I'm going to do. And then I go back without having the service. So from that, we come up with idea. Then we thought that we as electronics and telecommunication engineering students, what can we do in order to solve such a problem using the technology? So we thought that if we could develop a device that could give the products, contraceptive pills, condoms, without engaging the second person, would be the incredible solution. That's how our idea came.
Wow, a real youth problem and an African problem. Because I don't often see the self-vending machines. I don't know if you are an early bird in the sector or in this domain, and you're going to reap the benefits. If Mushuti Wanjye Kiosk takes off, then you are addressing a real problem that we have today. So taking the universities as an example, how is this challenge normally addressed?
The way this challenge can be addressed, we can say that at university we are having the approach, or if I can say it's like the program that builds young people, giving them all resources so that they can build the solution. But the solution that we are coming to build, we must look around us, the problems that are in the society. So the university is giving all resources, the concept that is needed for the individuals to develop the solution. First, they give us the sources, the knowledge, training, mentorship, so all help those young innovators like us to develop a solution that are solving the existing problems in society.
So there is the society issue of judgment when someone is accessing such resources. Like I see them on display at the supermarket, and I wonder how someone will go to line up to pay for those services in public. So now you come up with a self-vending machine, which is strategically stationed at maybe the university, and anyone in need of that service walks to the kiosk in complete, discreet manner, withdraws whichever product that they want. So this protects them health-wise, and also resolves the issue of interception of education, even in secondary schools, if we could address that, because most dropouts are due to early pregnancies, and also life is kind of cut short or changed when someone gets an STD or an incurable disease because of lack of such services, in the absence of awareness and prevention.
Yeah.
So, Mushuti Wanjye, talk more about the company and how it was started, who makes up this company, where is the funding from?
Yeah, thank you. Mushuti Wanjye, as name is sounding, it's like feeling that someone is your friend. If you have a friend, you cannot fear to tell him anything. Yeah. So the Mushuti Wanjye means that you are free to have services without fear of judgment. So then you asked where the idea came from. The idea sparked when we were in the house with my colleague, and when we were scrolling online, we found the announcement from Emoto Foundation, and it was about calling the young innovators to make innovative solutions using technology that can address the critical challenge in sexual and reproductive health sector. The challenge was to improve the quality, to improve the access of quality information and services regarding sexual and reproductive health, especially to the adolescent and youths. Then from that, we made a research. We found out that like 8,000 adolescents got pregnant in Eastern Province, and that was really pressing concern. And then we continue to find out what is the root cause of that problem. So we found out that the root cause of problem is fear of judgment, which leads them to do unprotected sex. But it's not because they can not have the services, but it's because they fear judgment from the other people. Like if the young woman had the sex and is going to the hospital like to buy contraceptive pills, she may think that doctor is going to know that she did something. So that could be a barrier. So we thought that if we could develop a solution, standalone product which can be placed at the private area, the people can easily access the services without fear of judgment. So then we go through design thinking process, we do the empathy. That one was the empathy to know how other things. Then we define the problem. Then the ideation came from how we can now use our technology. Technology, I say, is embedded systems, artificial intelligence. For us, we use the embedded systems and IoT so that you can even see the product usage. Like you can know how many people access the condoms at which time. From that, other officials can do data-driven decisions. So we built a prototype and then we went to the competition, and hopefully we won the second place at national level, and we were able to be granted for 10 million francs.
Wow, what an inspiration to the followers, the youth, innovators, and anyone who wants to contribute to the society development. So now, this is already a business that is taking off. Already you're winning national competitions, and I'm sure you're going international, but at some point we need to go the production route. So have you looked at what is needed for you to go live? In terms of the hardware, in terms of the scale of production, addressable market, and all that?
Thank you. So far, we have already defined our prototype, depending on the feedback from the users, because we also got the feedback from our classmates around, telling us how we can improve the device to make it a favorable product. So as we have our prototype refined, currently we are writing the technical requirement document so that we can order for mass production. We already had a manufacturing company in China and called Zongda. We are dealing on how we can do mass production. We gave them our technical requirement. They are doing the hardware, and then when the product first came here, we are going to do the software integration, like so that user can do payment and insert the code, so that it's going to be a good solution.
Wow. I keep saying wow because I'm amazed at how the solution is now going to scale within a short period, because this is a real need that you are addressing. Welcome back to The Niche, our viewers online. The Niche is a YouTube channel that discusses innovation, exemplary entrepreneurship and business skills, or strategies that can be adapted. And we are here at the Unipod within the University of Rwanda, campus of science and technology, where we have met a few young people, outstanding innovators in the space of artificial intelligence, UAVs, and now an IoT embedded systems which address the real society issues. So once again, Jean-Claude at Mushuti Wanjye is a friend in need, right? And now you're going to address or cut out the issues of early pregnancy, unwanted, cutting short of education programs, because someone has fallen ill from an STD or incurable disease. So once that is addressed, then, and I like that you are intercepting where maybe where we are still falling short in terms of access. If I would say automated access, because I don't think there is lack of reproductive health materials, but the way to access it. Yeah. And let's talk about affordability. So when you have installed these vending machines, how affordable are these services going to be? Is it as the usual, or there's going to be an additional cost to the buyers?
You mean the cost for the product, or?
The cost of the product, of course, to you, but also to the customer. So the fact that normally I see the kiosks within the expected places where those services would be needed, but they are man-handled. There is an agent there. So now these will be automated self-vending machines, and I would like to know if the cost is estimated to be the same as when you walk into a kiosk and buy the product.
Thank you. For us, as you said earlier, we are trying to improve the accessibility. Because when you look in Rwanda, there are other non-profit organizations. I can say like HDI Rwanda is providing the condoms. But when you look on the way it is being done, it's like they are taking those products, they put it in, for instance, washrooms, and even one people can go and drop all the products. Oh. So when you look on the impact, you found out now. So for us, what we're doing, we have a device, automated dispenser, which can automatically give the product without engaging the second person. Then for the product, we're not the one who are going to buy them and insert it into the device. We are going to have partnership with those non-profit organizations like HDI Rwanda, UNFPA, so that they can give us their product, and then for us to be like giving them channel so that they can distribute the product, ensuring that they are making the impact in the society. So for the condoms, the cost will be almost free. But for the contraceptives, because they are quite expensive, we are looking for how we can set the affordable price. Yeah.
So the cost of you running the business, how will you get a sponsorship, or you pass on the cost to the customers?
Yeah, thank you. So according to our business model, because we had a business model for our company, the way it is planned, we sell our devices to those non-profit organizations. And then we can work for them for maintenance, even for distribution, and then they can load their products. It's like giving them the channel. For us, we are selling the device, but also ensuring that we are contributing to making the impact in society.
Indeed, this is a worthy cause for anybody to invest in, leave alone the NGOs and the non-profit. Those international organizations and the government, of course, which is always looking for a way to safeguard the health of its youth and even the older populations. I'm sure they will not be excluded. Yeah. So how has the education, I'm sure you're a recent graduate from here, and have you pursued any further education, or it's your bachelor's degree that enabled you to achieve all this?
Yeah, it's my bachelor's degree.
So this was really a practical hands-on education, I would say, and I would commend the University of Rwanda for having, produced such material. So what would you advise your younger brothers and sisters that are still coming up in the field of engineering, science and technology? How would they fine-tune their skills such that they can be able to be relevant on the market?
Thank you. For young innovators who are coming to solve the societal problems, the advice that I can give to them is first to always start with an end in the mind. Like, if I'm going to solve a problem, what do I want to bring on the market? For us, we were about to bring automated dispenser. For making that machine, it requires to know what is to be placed where, at which reasons. For instance, like you must understand the root cause. What is the problem? Why is it a problem? Then how can you solve such a problem? The second one is about curiosity. For me personally, I am curious. I always like to learn a lot of things. Like even you can see this car was a soldering iron when I was 5. So curiosity read everything. If you want to design something, you need to also, I can talk about commitment, because today we have a lot of social media where you can spend a lot of time. But if you want to learn, first start with end in mind, then look for how you can do it.
Be specific. And aligned to your goals. Very good advice from Jean-Claude at Mushuti Wanjye, self-dispenser kiosks that are addressing the issue of sexual reproductive health. And a very commendable job, Jean-Claude. I would say that you're very ready for when the opportunity comes, and I'm sure the opportunity is all around you. It's just a matter of readiness. So once again, viewers online, we thank University of Rwanda, Unipod, for hosting The Niche. The Niche is an innovation talk show that focuses on emerging technology solutions as well as entrepreneurship and business strategies that are to be worthy to be emulated. So these young people are out here producing the solutions that we've been probably not expecting at this point, but they are ready because their mind has been opened up. And as he mentioned, we in the past we have been going by the saying that curiosity killed the cat. But indeed, it did not kill the cat, but it killed the problem. So now, because Jean-Claude and his friends were very curious, that's why we have achieved such a solution. Advice to the secondary school students and universities, even at primary school, try to target, to know what you are aiming at, what you're trying to resolve. Education is not just for the sake of going to school. You have to solve a problem, especially within the STEM and engineering departments. So thank you very much, Jean-Claude, once again. I'm sure that we'll keep following up with you to see how far the project goes. Any last words or call to action?
Thank you. I would like to thank University of Rwanda for equipping us with all this, but most Imbuto Foundation. And at the top, Government of Rwanda for always trying to push to equip young innovators like us with all available resources so that we cannot be limited. We can achieve more. Thank you.
Thank you very much. Again, we are a sound of applause to you, to the University of Rwanda, to the Government of Rwanda, and all other partners that are going to have made this happen and going to work with Mushuti Wanjye to make this a real solution in the markets.